Welcome to Session 4, Planning a Safe, Healthy Learning Environment. During this session, you will learn how to prevent illness and disease from spreading and how to plan nutritious meals and snacks for children in your program. The objectives for healthy. You will be able to understand what germs and diseases are, know why children in child care settings have more illnesses, identify 4 major ways illnesses are spread, and know how to reduce the spread of common childhood illnesses. The objectives for nutrition. You will be able to explain the importance of a healthy diet. You will be able to describe nutritional problems that can result from a poor diet. You will be able to identify the food groups using the MyPlate and the main nutrients they supply. You will be able to plan nutritious and appealing meals and snacks for children. In your CDA Competency Standard Book, Functional Area 2, we will be discussing healthy. You will be able to provide an environment that promotes health, prevents illness, and teaches children about good nutrition and practices that promote wellness. Let's look at the different ways of preventing illness and disease. We will discuss what are germs, the 4 ways germs are spread in childcare, 5 ways to prevent illness, the proper hand washing techniques, cleaning, sanitizing, and disinfecting, and the proper way to diaper a child. What are germs? Germs are very small, living organisms which cannot be seen without a microscope. Germs is a generic term for tiny organisms which grow and multiply in number. Germs which cause disease are commonly called pathogens, infectious agents, contaminants, or even bugs. Not all germs are harmful. Some germs actually help the body to remain healthy. Germs live and multiply best in environments which are warm, moist, or humid, dirty, soiled, and dark. Disease-causing germs can live in the air we breathe, the food we eat, the water we drink, the cuts and sores we get, and they can live on surfaces that directly and indirectly go into the mouth. Some diseases take exposure to very few germs to make us sick, while other diseases take a large number of germs to make us sick. The way they live or how they are prevented, treated, managed, or killed identifies subgroups of germs. Subgroups of germs include bacteria, fungi, including yeast, molds, parasites, and viruses. Germs are reduced to safe levels by the practice of cleaning with soap and water, and rinsing with fresh water. Bathing, showering, shampooing, laundering, mopping, cleaning, and washing are ways to reduce germs. Germs are killed by the use of germicidal agents, such as bleach and water or other solutions appropriate to the germ. Physical agents, such as prolonged high heat temperatures or in some cases freezing. Some germs and/or parasites are killed by prolonged exposure to sunlight. Germs are so small they can live in cracks, chips, and broken surfaces found in floors, tabletops, and mouth toys. Germs can live easily on unwashed hands, on bathroom fixtures and diaper surfaces, as well as in improper prepared or managed food, baby bottles, beverages, and food preparation areas. Germs can enter or leave the body in several ways. The most common routes are through the nose, mouth, eyes, stool, open sores, and occasionally urine. The following are 4 ways germs are usually spread. The respiratory or airborne. This occurs when infected droplets from the nose, mouth, sinuses, throat, or lungs are coughed, sneezed, talked, drooled, or spit into the air or onto other surfaces. They are then inhaled when we breathe. They can also be spread indirectly from infected items like tissue, mouth toys, cups or glasses, toothbrushes, or food. When infected items come in contact with the nose, mouth, eyes, or another individual, they become exposed to the disease. Another way germs are spread is through direct or close contact with skin, hair, and sores. Germs are found in infected body fluids such as saliva, spit, drool, urine, eye discharge, nose mucus, throat mucus, or discharge from the open sores. They are spread by directly touching the infected skin, drainage, or body fluid. Head lice and scabies are spread by direct contact with the individual infested with the parasites. Indirect contact from infested items such as clothing, hairbrushes, combs, hats, car seats, linens, and upholstery furniture can also spread these parasites. Another way that germs are spread is through fecal or oral. Germs found in stool are passed from the body and are spread to items such as food, toys, tabletops, fixtures, diaper areas, and drinking water by unwashed hands or unsanitary conditions. Germs enter the body when contaminated items are touched and then unknowingly ingested. Diarrhea is the most common sign of intestinal infection, although some individuals may not look, act, or feel sick when they pass germs from their body. Here are a list of ways to prevent the spread of germs. Wash hands frequently and properly. Keep air fresh. Allow space between cots, cribs, and furniture. Clean and sanitize toys, furniture, and area for eating, toileting, and diapering. Teach children and staff to cough and sneeze correctly, using the elbow sneeze. Keep all personal items separate. The fourth way is through blood contact. Infected blood from one individual enters the bloodstream of another individual, usually through small cuts or breaks in the skin of the uninfected individual. Germs enter through the mucous membranes of the eyes, nose, mouth, rectum, or sexual organs, or by sharing contaminated syringes or needles from an infected individual. Infected individuals often may not know they are infected. Laboratory tests are needed to identify infection or disease. Some of these diseases include HIV, hepatitis B, and other like hepatitis C. Number 2, require immunization to be up to date before admission. Ask the parent or guardian to bring in proof of immunization. Determine the child's age. Compare the immunization record with the recommended schedule to see if all shots are up to date. For questions or concerns, call the state immunization program, your local health department, or health consultants. 3, exclude ill children from the group. Carry out an exclusion policy so children who are ill do not attend, or if they become ill, they are isolated from other children until picked up by parents. A list of illnesses requiring exclusion include persistent abdominal pain, pink eye, diarrhea, fever, hepatitis A, impetigo, measles, mouth sores, mumps, head lice, whooping cough, pinworms, rash, scabies, strep throat, tuberculosis, chickenpox, and vomiting. If a child or staff develops a reportable disease, call the local health department immediately. Visit the Florida Department of Health website at www.doh.state.florida.us for a complete list of reportable diseases. The fifth way to prevent illness is be prepared. Put your health policies in writing and distribute to parents and staff. Get CPR and first aid training and stay current. Florida licensing rules state at least one staff person trained in CPR as evidenced by current documentation of course completion. It must be present at all times that children are present. Develop emergency plans and procedures and document regular practice drills with staff and children. Remember, proper hand washing is the single most effective way to stop the spread of disease. Wash your hands often. Soap assists in loosening and removing germs from the skin. Friction from rubbing hands together loosens the germs. Running water flushes germs away. Wash hands for at least 20 seconds. Type of soap to use. Any type of soap can be used. The important thing to remember is that soap plus vigorous rubbing is the key to effective hand washing. A mild soap is recommended to reduce irritation to the skin. A disinfectant soap is not necessary. When should staff and children wash their hands? Before and after eating, preparing meals, snacks, or bottles, preparing or giving medication, treating a wound, tending to someone who is sick, taking a temperature, entering the classroom, playing in water table. When should they wash after? Using the restroom or diapering a child, playing with pets, blowing your nose, coughing, sneezing, or helping children with tissue, handling garbage, playing in the water table, removing gloves after handling bodily fluids, outside play, handling uncooked foods, messy activities, and tending to someone sick or injured. Maintaining sanitary conditions during toileting, diapering routines is necessary to minimize the spread of germs in the early childhood classroom. Having so many children sharing space, equipment, and materials for a large part of the day makes it easy to spread germs among both children and adults. In terms of toileting and diapering, the diseases spread most frequently are those that are passed from contaminated hands to mouth, especially intestinal diseases that cause diarrhea. A vast amount of contaminations can occur during toileting and diapering routines in early childhood programs. Early childhood programs are often looked upon as being the place into which germs are carried, transferred to others, and then spread out into the community. However, studies have shown that infections can be reduced by half when proper sanitary procedures are used in the early childhood programs. Such procedures help prevent the spread of disease within a program and limit the spread outside the program as well. Cleanliness not only makes the environment look better and feel more comfortable, but it also helps reduce the presence of disease-causing organisms. Classrooms should be cleaned nightly by a custodian. Special attention must be given to bathrooms and diapering areas, drinking fountains, and kitchen and meal service areas. Classroom walls and floors should also be cleaned on a regular basis. Doing laundry is a part of the cleanliness routine. Cot covers, blankets, sheets, pillows, and pillowcases should be washed weekly or whenever they become soiled due to toileting accidents. To limit the exchange of illnesses, children should each be assigned a crib or cot complete with personal bedding. Cots should be labeled with children's names. Kitchen towels, clothes, and aprons should be laundered daily. Children's dress-up clothes, puppets, stuffed animals, and pillows require regular cleaning. Sanitizing is essential. Toys and equipment need regularly sanitizing. The health department has information on how to sanitize items. Eating tables should be washed and treated with a sanitizing solution before and after each meal. Diapering surfaces must be sanitized before and after each use. A sanitizing solution frequently used in child care programs is 1 part bleach mixed with 4 parts water. Let's move on to nutrition, meals, and snacks. The basics of good nutrition. Nutrients are the substances which are found in food and used by the body to function, grow, repair itself, and produce energy. Nutrition is the process through which the body utilizes the nutrients in food. Some nutrients provide energy for activities, such as running or playing a computer game, and for essential body processes, such as pumping blood and digesting food. Other nutrients help keep the body working smoothly. Without the right balance of many different nutrients, the body cannot produce the energy it needs. It cannot function properly and has less resistance to illnesses. Good nutrition is especially important in the early years. It provides the foundation for children's normal physical growth. Proper early growth and development are critical to having a long, healthy life. Nutrition affects intellectual development as well. To function properly, the brain must receive important chemicals from nutrients on a regular basis. Most of the brain's growth occurs in the first 2 years of life. Research has shown that well-nourished children learn better. Take a few moments to review the MyPlate video connection.
Today we'll be talking about the latest dietary methods used to promote healthy eating habits called Choose My Plate. Choose My Plate illustrates the 5 food groups needed to provide the necessary building blocks for healthy eating. These include fruits, vegetables, grains, protein-rich foods, and low-fat dairy. Fruits and vegetables should account for just over half of the food on your plate, with vegetables making up the slightly larger portion. Vegetables include everything from eggplant, broccoli, and bell peppers to spinach, lettuce, and squash. The best rule for choosing which vegetables to eat is simple. Boost variety and eat as many colors as possible. This ensures that the body receives the optimal amount of vital nutrients, vitamins, and antioxidants. When preparing vegetables, try and eat them lightly grilled or raw if possible. Oversteaming vegetables is a common mistake and causes the vegetables to lose most of their nutrients. With fruits, it's important to boost the variety and diversify the colors as well. They are an excellent standalone option to eat raw or cut up in a fruit salad, and they also act as an excellent complement to sweeten up a salad or entree. Brightly colored fruits such as raspberries and blueberries are also very high in antioxidants that work to inhibit the development of heart disease and certain types of cancer. Next, we have the grain portion of the Choose My Plate model. Grains are an important part of the healthy diet as they supply complex carbohydrates and contain a significant amount of fiber with little fat and no cholesterol. Grains should make up about a quarter of your plate and are found in everything from bread and cereal to pasta and oatmeal. When we think of grains, we usually think of wheat or rice, but options like quinoa, millet, and rolled oats make for even healthier options. With all grains, it's a good rule of thumb to choose whole grains rather than refined or processed grains to make sure the body gets the most nutrients possible. Protein foods will account for the rest of the plate. This includes anything made from meat, poultry, seafood, beans, eggs, processed soy products, nuts, and seeds. From this group, it's better to choose lean or low-fat choices like chicken, fish, and other seafood to ensure minimal intake of cholesterol and saturated fat that often leads to later health issues. The final and smallest portion of the Choose My Plate dietary method is the dairy portion. This includes all fluid milk products and foods that are made from milk like low-fat cheese and yogurt that retain calcium content as well as calcium-fortified soy milk. This does not include foods made from milk with little to no calcium such as butter, cream, and cream cheese. It is important to try and eat around 1 cup per meal of low-fat dairy, which is equivalent to 1 8-ounce glass of milk, 1 regular container of low-fat yogurt, or 1.5 ounces of hard cheese, to ensure the optimal health benefits. With the new Choose My Plate dietary guidelines, the delectable possibilities for nutritious meals are endless. Take what you've learned today and stock that fridge full of the best foods that your body needs.
Special consideration should be made for meal planning. Some children may be unable to eat certain foods because of allergies or other medical problems. In addition, religious beliefs may call for avoiding certain food or food combinations. Be sure to ask parents about any such restrictions that may apply to their child. Keep a convenient record of these restrictions to consult with when planning meals. Food safety and sanitation. Food that is spoiled or tainted with bacteria can cause serious illness in children and adults. Anyone preparing to serve food must be trained in food safety and sanitation practices. Sanitation means practicing cleanliness to prevent the spread of illness and disease. Harmful bacteria and other disease-carrying agents can easily spread from unclean hands or equipment to food. To limit the spread of these agents, foods handlers must wash their hands with hot, soapy water before beginning food preparation. They must take care not to cough or sneeze on the food. Like all others in the center, they must wash their hands after coughing, sneezing, blowing their nose, or using the restroom. In addition, hand washing is necessary after handling raw meat, poultry, fish, or eggs. Equipment that touch the raw food, such as cutting boards and knives, must also be scrubbed in hot, soapy water before being used for other foods. Preventing tooth decay. An eating pattern of frequent small meals and snacks is fine for nutrition, but can be hard on the teeth. Food particles react with bacteria in the mouth, resulting in acid that attacks tooth enamel. For good dental health, encourage children to brush their teeth after meals and snacks. Of course, we know that this question is true. Young children need adequate sleep to maintain healthy bodies. A daily schedule usually allows 30 to 90 minutes of nap time. Children age 5 and older may not need as much sleep as younger children, but they do need at least a short rest period. Most states require nap time in their licensing laws. Nap time should be the same each day. It is usually following lunch. While one teacher helps children brush teeth and toilet, another sets the cots throughout the room. Each child needs a personally labeled cot. For familiarity, each cot should be placed in the same place every day. For safety, there should always be at least 2 adults present in the room during nap time. Nap time can be scary for young children. Teachers should make it as comfortable as possible. Reading a story in a dimly lit room with a ceiling spotlight on the teacher creates a calming mood. After the story, relaxing music can be played throughout the nap. Nap time should also follow a sanitary provision. All children should sleep in a special, clean nap area. They do not rest directly on the floor or sitting at tables. Nap areas are not crowded, should be 18 inches apart, and should be relaxing. Nap time should also follow a sanitary provision. All children should sleep in a special, clean nap area. They do not rest directly on the floor or sitting at tables. Nap areas are not crowded, should be 18 inches apart. Sanitary procedures for diapering a child preparation. Diaper surface should be smooth, non-absorbent, and easy to clean and sanitize. Wash your hands. Organize needed supplies within reach. A clean disposable diaper, disposable wipes or dampened paper towels, roll paper or non-absorbent paper sheets if used, gloves, plastic bag for soiled clothes if needed, ointment, swabs, or tongue depressors to apply ointment, a plastic-lined waste container with lid. The dirty phase. Place child on diapering surface. Using only your hands, pick up the child and hold the child away from your body, or have the child climb small steps up to the diapering area. Assist child in this process. Do not cradle the child in your arms and risk soiling your clothes. Keep one hand on child at all times. Keep other children away from diapering area. Remove child's clothing. Put soiled clothing aside and later into the tied plastic bag. Remove soiled diaper. Roll diaper inward. Place diaper into waste container or out of the reach of children. During this week's assignment, you will complete reading in your text, pages 39 through 74, a library scavenger hunt. You will complete the competency standard statement 1, and you will also write in your workbook assignment for healthy.